All right. So first of all, my name is Greg Schuster. For those I haven't had a chance to meet yet, I'm the interim business administrator. I want to thank all of you for joining us today. First off, just to let you know, this is being recorded, so we can play it back for other employees who won't have a chance to either make this session or the next session. We do know that there's a lot of questions out there regarding the vaccines, primarily the two that are in use right now. So what we want to do is provide a forum for everyone to go ahead and learn a little bit, and more importantly, ask questions that you may have. We know it's a lot going on right now, when everyone's getting information from all kinds of sources, some reputable, some not. So what I want to do is make sure that we have a forum here in which you can ask our experts or our health department, and we have Candace and Anna here from our health department to go ahead and answer any of those questions. During this webinar or session, feel free at any time to either use the chat or Q&A button to ask your question. We'll do our best to go ahead and answer it right here on the live. And when I say we, I really mean Candace and Anna, because they are in fact the experts. I'm not an expert on anything health related, I can assure you. So as I said in the email, there are a couple things that we're not going to get into. If there are any specific questions about benefits, sick time, and all that kind of stuff, we're happy to talk about that, but that would be a sidebar conversation between you and administration. We'd have to look at the policies and any union contracts that are involved in that to answer those questions. And second, and very importantly, we're not going to get into any specific health related questions. If you have questions about you or a specific individual, that really needs to be addressed with your doctor. So we were unable to go in there. So with that, I just want to turn it over to Candace and Anna to go ahead and talk briefly about the vaccines and the process. And after that, we're going to open it up to questions from all of you. So with that, I'll turn it over to Candace and Anna.
Hey, everyone. Thank you and Happy New Year. Thank you to Greg and Glenn for coordinating this. So we did receive a few questions from staff, which I will let Anna read off. And then if you have additional questions, as Greg mentioned, please add them to the chat or the Q&A, and then we'll answer them during the session. But just so that you know, those of us who live in Maplewood or work in Maplewood would be allowed to go to the Essex COVID site at Livingston Mall, which is at the former Sears site at the Livingston Mall. At this time, though, they are only doing 1A tier, which is tier 1A is only for healthcare providers who are in direct or indirect contact with patients who might be sick with COVID or infectious materials. So those would be the only people, as well as those who work at long-term care facilities, like the staff who work at nursing homes or skilled nursing facilities, and the residents there. The reason being is that these two groups are the highest risk because they are frontline providers of healthcare, or we've seen a lot of our cases back in the spring in long-term care facilities like nursing homes. So they are most at risk because they're a congregate setting. As we move forward and we vaccinate more people, the next tier will open up. Tier 1B is looking to be more of the essential workers and first responders. They're also considering opening that up to those in the age group of 75 and older. Once you move on to that, then it begins to open up to a wider pool, which is the general public. Essential worker, you'll probably be interested to know, would mean pretty much all of municipal government personnel. There really isn't anyone whose job could be substituted for anyone else. So that's when we would qualify, but that's 1B, which is coming up soon, not just yet. If you wanted to sign up, we just learned yesterday from the state health department, there is an ability to sign up on covid19.nj.gov to pre-register yourself for a vaccination for an upcoming tier, but they're still working out the kinks. So that is more to come, and provide more information on that. But if you do know someone who's a healthcare provider or who works or lives at a long-term care facility, those who are healthcare providers can sign up on www.essexcovid.org. Those who are in long-term care facilities are already getting them directly from Walgreens and CVS. So they have a federal contract to deliver directly to them, so they don't need to sign up on the website. And our location is open 6 days a week from 9 a.m. to 4 p.m. And it's free, it's paid for and already done. So none of it comes out of our insurance per se, but they will ask for insurance, but you don't have to pay out of pocket, excuse me, that's what I meant. The one last thing that I wanted to mention is testing. So testing is still available also through essexcovid.org. You can schedule a test on that website. Testing is super important, especially after the holidays. If you think you have been exposed to a suspect or positive case of COVID, or you have traveled outside of New Jersey and you wanted to just see your COVID status and see if you're positive or negative. And we're happy to answer questions about testing too. Just know that that's available, and we highly recommend everyone getting tested if they think they would like to know their status. Anna, do you want to go into answering some of those questions that were proposed? And I'll jump in.
Yeah, of course. Yeah, of course. So I'm just going to start with a little bit of background on Essex County vaccination. The Essex County vaccination is the Moderna vaccine. There's two different ones. There's the Pfizer and the Moderna. Essex County has the Moderna vaccine. That one is 28 days from the first dose to the second dose. So both vaccines are 2 doses. Pfizer is 21 days in between. Moderna is 28 days in between. Now, a lot of questions are, what if I miss my second dose in 28 days? How long after can I get it? Is it still safe to get it? Do I have to restart the whole series? What do I do? So the state health department, as we all know, everything is being researched, and we're still in the process of getting a lot of answers. But as with many vaccines, the 28 days, those days are just a very, very high recommendation, and you should try to get it as soon as possible to that 28 days. So if you miss the 28th day, let's say you are you're busy with work or childcare or something like that, try to go on the 29th day, the 30th day, the 31st. Try to get there as soon as possible to the 28th day as you can. Once you receive the vaccine, can you be a carrier of the virus? So we cannot give you a definitive yes or no on that question just yet, as there is still a lot of research being done, and there's not enough information to say whether or not someone can still transmit the disease if they are asymptomatic after getting the vaccine. So when you're getting the vaccine is technically supposed to prevent you from contracting the disease or showing any symptoms of the disease. So it's helping your immune system fight it off. But we cannot answer if you can carry it to another person if you don't have any symptoms. As we know, this virus shows both asymptomatic and symptomatic instances. So we are still trying to figure out the asymptomatic transmission on that one. So the CDC still recommends, even if you get the vaccine, to continue to social distance, to continue to wear your mask, to continue to quarantine. And that's a big question as well. If I get my vaccine, do I still have to quarantine if I was in close contact with someone? The answer to that is yes, because we still do not have a definitive answer as to whether or not we can carry and transmit the virus. The point is herd immunity, and herd immunity means that majority of the people should get the vaccine. That way their virus cannot make a home in anybody, and that way it can be eradicated.
Anna, we do have a few other questions that just came in from chat. If I can interrupt here for a second.
Of course.
So the first question is, how concerned should we be if we have allergies specifically to shellfish?
Okay,
Yeah,
so
do you want me to take that, Anna, or?
you can go ahead, take it.
Okay, super. So, and then chime in if I've said something else. For allergies, with regards to the Essex COVID site, the county site, they are saying that anyone who has any allergies to a vaccine in the past, right, any flu or any type of other vaccine, to go to your healthcare provider and go directly to them. The county site is really open for the general public. So they really are advising people who have concerns with allergies, whether it's to shellfish or to anything else, to prior vaccine really is the main concern, to go to their healthcare provider directly and seek guidance before they come to a general vaccination clinic. Anything else that you wanted to ask on that? Add to that?
I want to just add that Pfizer and Moderna both have different allergic reactions. So Pfizer tends to be more, it tends to show more anaphylactic allergic reactions in people than Moderna does. So when you do talk to your doctor, they might suggest you to get the Moderna versus the Pfizer, or they might suggest you wait for another vaccine that has less allergy reactions. But that's definitely something you need to talk with your doctor about, as they know your medical history way better than.
So the
we do.
bottom line on that question is talk to your doctor.
Exactly.
Right.
Right.
Next question, do we know if you are still able to carry the virus and spread it after vaccination? And I think this was asked right as you started to actually answer this question. So I'm pretty sure you've already addressed this. The answer, if I heard correctly, is you just don't know at this point. There's not enough research. And the next question we have in the chat is, if you already had COVID, are you eligible for the vaccine, and is it advisable?
Right. So, good question. If you already had COVID, yes, you are eligible to get the vaccine. They would recommend, however, that you get the vaccine after you're completely recovered, right? So no symptoms, you're feeling good. You could even postpone getting the vaccine for 90 days or 3 months after your initial infection, because they say that natural immunity thus far, we know, lasts for about 3 months. After 3 months, we're not sure about that natural immunity and when it starts to wane, but it starts to wane around 3 months. So if you wanted to put off getting the vaccine for 3 months after your initial infection, you can do so, because you'll be protected by natural immunity. However, you can also get it tomorrow, so long as you're feeling good, you have no other symptoms, and you're completely resolved and out of isolation.
Thanks. That's all the chat questions we have right now. So everyone out there, please feel free to keep sending in those questions. In the meantime, do you have other questions that were emailed ahead of time that you want to address?
Yes, so just a few. Someone asked if COVID testing was required prior to the vaccination. It does not require prior to the vaccination, as Candace just mentioned. Just make sure that you are not sick and are contagious or have been diagnosed with COVID-19 in the past 14 days before you go get vaccinated. Scheduling, am I required to set up an appointment myself, or does the township have a block of days available? So no, every employee is responsible for setting up a vaccination appointment for themselves. It's an individual process. The township does not block off any days. So to when 1B is available, you can go to essexcovid.org and register, and the county will confirm your email and send you an appointment time, but that is all on your own time. And that is about all the questions. Oh, the possible side effects of the vaccine. There are possible side effects of the vaccine. A lot of the side effects are the common side effects that we would see with other vaccinations. So headache, soreness, you might even develop a fever, and that's okay because your body is initiating an immune response. The fever, those side effects are because the body is initiating an immune response. So it's not something necessarily per se to worry about so much, unless it becomes life or death, like an anaphylactic reaction. But headache, sore throat, nausea can be a side effect, soreness, muscle aches, all those common side effects. Less common side effects include like vomiting, diarrhea. Candace, help me out here on the side effects.
No, I think that, those are
Yeah.
pretty much the main side effects, but I do want to emphasize this very important thing that Anna just said, which is that when your body, when you're sick and your body responds to a fever or body aches, it is your body's natural response to fighting off the disease. So when you're getting a vaccine, you're getting a small dosage of that vaccine, of that disease, so that your body can start that immune response, so that if you get exposed to the big kahuna, right, the actual disease, your body's going to say, wait, I know that. I've seen that before. I have an immune response that I've been generating. So when you get the vaccine, that's why you might get some soreness at the site, but the fever also. Let the fever ride. It's totally normal. It's not because the vaccine is bad. It's because that is your body's immune response to developing those antibodies that you need to get immunized. There's one question. We've had some delays in response from EssexCovid.org for vaccination, some have heard faster than others. Is that just due to volume or due to how members answered the pre-vaccination questions?
I can
Um,
answer that.
Yeah, Anna, go ahead.
So there is a delay, and that is because of volume, because a lot of people unfortunately are signing up when it's not their turn yet. So many people are signing up under the 1A, even though they're not healthcare workers. So the county has to fledge off who is a healthcare worker and who's not. So that's the delays. In my own personal experience, I registered on December 24th, and I didn't get a confirmation email till yesterday. So it took about 10 days. So if you haven't gotten it, a lot of the confirmation emails are coming either the week of the day that you picked or a couple of days prior. If you have not heard from them and it's a couple of days prior to the date that you picked to do the vaccine, I would call their phone number that's listed on our, I can find it right now and put it on there.
All right, and I see Glenn posted up a link for more information, covid19.nj.gov/vaccine. Is there any other recommended sites or locations that the two of you would recommend people can go to get the true and correct information?
I would continue to go to our website. We are constantly updating our township's COVID-19 portal, including referring to our COVID vaccine overview. It's that 11-page blue document. We'll also be coming out with a second one shortly. It'll be another one with an update of some communications on the vaccine. So keep a lookout for that. That should be coming out at the end of this week.
All right, thank you. And I see Glenn posted up a few links there to what you just talked about. And we're just going to give it a second to see if there are any other questions from anyone out there attending.
We also want to say that one of the things that Glenn has also posted up is that there are other vaccination sites for healthcare providers and those who work at long-term care facilities. So not just the 5 county sites for county residents who are healthcare providers. There are other locations, and I believe that we have them up on our website. So places like federally qualified health centers, the ShopRites in Livingston, for example, various pharmacies and healthcare providers are now able to give vaccine to healthcare providers. So it alleviates that overflow and that, one-stop shopping at the county sites. You can go to other places as well. So when you see that covid19.nj.gov/vaccine, if you wanted to register for those other locations and you're a healthcare provider, they might funnel you to those sites. They're kind of like the overflow for the county so that we can get as many people under Tier 1A vaccinated as possible.
All right, thank you. And I see Roseanne has, Glenn's letting Roseanne in to say, go ahead and unmute yourself, Roseanne.
Yeah. Okay, can you hear me?
Yep.
Okay. When you're scheduling an appointment, do they offer alternative dates if you can't get your preferred date?
No, so when you're registering it, you pick a date that they have, and then they will send you a time for that date. If they do not have any times available for that date, they will send you to reschedule the date. Unfortunately, they don't give you an option on the day unless you choose it.
So when you go on the website to schedule an appointment, do they show the blocks of time, dates that are available, or, okay.
They show the dates.
Yep,
They don't
they
show
show
the
dates.
times. They just show the dates.
All
So
right.
if you pick Saturday, January 9th, they'll just send you a time for Saturday, January 9th.
Okay, thank you.
Yeah, we also want to say that some people have registered, and similar to Anna and myself, we've registered like, almost a week and a half from now. And then some people hear like the day before that, okay, you have a vaccine ready for you tomorrow at like 9:50. So if you can't make it, you can call that number that Glenn put up. It's 973-877-8456, and just let them know that you received notification that you have a vaccine appointment available, but you can't make it because for whatever reason. They can see if they can reschedule you for a later time that day or some other time if that's possible. What they really want to do with this registration is it's helping them to count how many vaccines they're able to give per day. So long as they have, a set amount of people who will be coming, they know that they're going to give that set amount. So if they have to move you from like 850 to 1120, it's still 1 for 1, and they'd rather do that than lose you.
All right, we just had another question can't come in. How long after you receive the vaccine should any side effects subside?
I would say about 24 to 72 hours. If any more side effects subside after that, I would consider talking to your doctor because you may have an infection of some sort.
Right. So everybody's body is different. So and everyone's response to the Moderna vaccine will be different. Some people have gotten it and they're just like, I'm right as rain. I'm going back to work. I'm totally fine. Other people have said, wow, I just got hit by a Mack truck for like a day or two. So give it about, if you're going to get it, there's the potential that like for the day after, you might be like, oh, I don't feel so hot. So I'm going to rest. And that's normal. But yeah, if it goes past like 3 days, then definitely call your doctor and just be like, oh no, this doesn't feel right.
I also just want to add that, yeah, you can get the vaccine, but also remember that there is still a global pandemic going on, as well as the flu season and many other viruses out there. So if you do get the vaccine and symptoms continue, you might want to consider maybe having another infection of some sort. Don't just brush it off as the vaccine per se.
Thank you. And our next question is, will this become an annual shot? Can it be given at the same time as the flu shot?
Great question. We don't know what how long this vaccine coverage will last. All we do know is that it is 95% effective to exposure. So once you get those 2 doses, you have 95% vaccination coverage, right? You have 95% chance that you will not get infected. And those are pretty good odds. How long that lasts, we're not sure because the vaccine just came out. So research will show what it is. That being said, coronavirus or COVID-19 is a coronavirus similar to the common cold, to which there's 100 different variations of this type of virus. So time will tell, and we'll have to see whether this is going to be an annual shot or whether this has the ability with this new technology that it's using to recognize any COVID or any coronavirus and apply its antibody work to it.
Thank you. And our next question is, will the vaccine centers test you before the vaccine, or do you need to get tested before making your appointment? Suppose you do not know if you are a carrier or an asymptomatic.
Anna, do you want to take that one, or? I can take it. So no, the vaccine centers are not going to be testing you prior to the vaccine. The rule of thumb is if you are sick, don't get it. If you have been maybe exposed to COVID and you're on quarantine, don't get it. Just make sure that you are well. You have not had symptoms in the past 2 weeks, and you have not been exposed at your knowledge in the past 2 weeks. As long as you fit those 3 criteria, you're able to get the vaccine. The carrier and the asymptomatic, unfortunately, we don't have the testing to test everybody before the vaccine. So that's the rule of thumb.
All right, thank you. Not seeing any other questions. I'll give it one last chance. If anyone wants to go ahead and put their questions in or raise your hand, and we'll do the best we can to get them answered. In the meantime, please encourage all the other employees you're talking to either reach out to the health department if they have questions. The next session for this is this Friday at 2 p.m. So please encourage other employees to attend there and get all their questions answered. I hope this was helpful to everyone. Again, this has been recorded, so everyone can go ahead and we'll put it up somewhere where people can listen to it and get some of their questions answered. So if there's nothing else, no other questions, I just want to thank everyone for attending. I want to especially thank Candace and Anna for all their expertise and all their hard work during this pandemic. Just to keep on encouraging everyone to follow all the protocols. Go ahead and do your research, listen to the appropriate authorities, and then hopefully get that vaccine and we get this pandemic over with. And I see one final question here. If we listen to this one, do we need to listen to Friday's session? Well, we always love your company, but no, I think if you got your questions answered here, you don't no need to really attend the Friday one. You are, of course, more than welcome to if you think it would help you out. But again, this is not the one and only time that you can get your questions answered. We're very fortunate as a municipality to have our own health department and our own health experts on board. So feel free to reach out and get your questions answered. So with that, I'll close things up here. I want to thank everyone for attending and of course our health department for